background noise. Thank you. Good afternoon, everyone, and welcome to the ADMS Compliance Department webinar Wednesday for today, July 27, 2016. This presentation is made by the ADMS Office of Compliance and Regulatory Affairs, staff members William Cundiff, Ricardo Sembe, and Alexander Osorio. Please note that during the terms of today's presentation, the terms Atlantic Dialysis Management Services and ADMS refer both to those specific organizations as well as the contracted network of affiliated dialysis centers and physician practice locations. Once again, I would ask everyone who are dialing into the call and listening via phone if they'd be so kind to mute their phone so we can avoid some of the background noise so other people can take it in. Thank you. Some recent items that occurred. Today's presentation is on bringing your own devices to work and what implications come into play for the organization and for the individual employees and staff members, and what liability may exist. Again, once again, I'm going to ask those individuals who are on the phone if they'd be so kind to mute their telephone and or cell phone so we can eliminate background noise and permit other people to listen. I know there's a couple of people on the line. I'm getting background conversations and humming and keystrokes. Most recently, the U.S. Department of Office of Civil Rights fined both the Massachusetts Eye and Ear Associates over $1.5 million when a laptop which contained downloaded patient data from a company email was stolen from a doctor's car while parked overnight on the street. Additionally, the Alaska Department of Health and Human Services was fined $2.7 million for a misplaced USB drive that its ID director could not account for in an inventory audit. Once again, folks, could you please mute your phones? In a recent study in Becker's Hospital Review, chief medical officers surveyed indicated that its patients lacked confidence in the security of their health records in a couple of different areas. And in that lack of security, 50% of the people surveyed said they would withhold their patient data. 38% said they would ignore their patient data. 42% said because of the lack of security in their healthcare facility that they would leave that facility and seek care elsewhere. 70% said because of the lack of data security on their health records that it looked poorly upon their healthcare provider. And almost 90% said that someone should lose their job whenever there is a breach of information. So when talking about BYOD, or bringing your own devices to work, and devices could be your own laptops, iPads, mobile phones, iPhones, that there's a series of program best practices that we want to address. So first off, we'll talk about today is data protection and security. We'll talk a little bit about employee privacy. We'll talk about what our organization does when it comes to respect of theft or loss. And then we're going to talk a little bit about workforce training and engagement. So to BYOD or not to BYOD, that is the question. So to bring your own device to work or not bring your own device to work, it's not a matter of when to allow your employees to bring their own devices to work. It's actually a matter of how to manage your devices to work. I think if you look around the workplace, if you look around at your coworkers, your employees surrounding you, folks, if you'd be so kind, please to mute your telephones. We're getting conversations in the background. We're getting patient conversations. So in a personal mobile devices being used in a clinical setting, many healthcare providers right now, such as Atlantic Dialysis and affiliates, are actually struggling with what to do about their employees and how the employees use their mobile phones and mobile devices in the workplace. So some questions we'll address today is, what is our organization's position on your employees' BYOD? What is our policy that speaks to whether or not we allow the use of personal devices?
Where are we, Bill?
And does HIPAA allow the use of personal devices to transmit or store protected health information? So BYOD benefits. So what are the benefits of individuals bringing their own devices to work and using it in a clinical workplace? Well, the first one is obviously there's increased productivity. And that increased productivity provides access to a couple of reasons. One, to advanced technology. One, to personal applications. There's also a workforce mobility. That increases employee satisfaction because they can work faster, quicker, more efficiently. And then we also have what we call mobile workers, individuals who go from location to location, who have access to their email or patient-related information quickly. And then more importantly, there are cost savings to the organization because there are a lack of hardware costs. What are some of the risks, and what are some of the examples of the risks by allowing your employees to use their own devices in the workplace? Well, first issue, a risk issue coming to play is security. And what are the types of risks under security? Well, first off, there could be a misuse of the mobile technology. The second risk is there could be a lost or a stolen personal device, which doesn't sound horrible per se outside of, wow, I lost my phone or I lost my iPad. But if that individual employee is downloading or accessing company emails, and in those company emails there is patient information, spreadsheets, documents, patient-related flow sheets that they're downloading to those documents, if those mobile devices are not encrypted or password protected, then anyone can access that information. Other risk issues apply to human resources. And types of risk may be with respect to labor laws. Are people accessing their corporate email outside of their normal working hours? And therefore, we're subject to labor laws. So are employees working after hours? And then there are issues about reimbursing costs, and is that considered income or taxable income? Again, folks, I'd ask you to please mute your phones. If you're listening, please, you're getting background conversations, and we're hearing patient-related conversations on the phones. Thank you. Other risk issues would be legal implications, such as, is there a confidentiality of corporate information that's being distributed? And also, are you storing personal proprietary business information, corporate-related financial information, policies and procedures which are confidential to the organization? Are you storing those information on personal devices? And then there are other hidden costs, such as, what are the support systems in place? What network systems are we using? How do we know that the applications are secure? Tinder, Instagram, Twitter. And then there comes issues with respect to compliance. How does the compliance department, how does your compliance officer, whether it's the compliance officers at College Point or the individual compliance officers at the dialysis centers, how do they manage those BYOD issues? So mobile devices and protected health information. What does the law say about mobile devices in a clinical workplace? Well, essentially, there's nothing in the HIPAA rules that state that you can't use a personal device to transmit any patient information. However, the HIPAA security rules state that patient information has to be protected, and when it's used securely by a covered entity, where essentially a covered entity is where the patient is based, then that has to be secure, whether that information is being used, is being transmitted, or being accessed. And the problem at hand comes to be with the use of mobile devices is who owns that phone or that portable device, and how do we enforce security on that device if we don't own it? Yes. Common conversations regarding mobile devices. So our phones in our dialysis unit are outdated. They break, they are inefficient, and they're 3 times the size of my cell phone. I can use my cell phone to text, and I don't have to use number keys to text documents. It's a lot faster. The response is, are you texting PHI? And if so, are you putting patient information at risk? Remember, as a service provider, your personal phone regularly backs up your phone in a cloud environment, and the storage is not secured. Other common feedback we heard is, I don't want to carry around more than one phone. Can't I use my own personal cell phone? Why do I have to use an ADMS corporate phone if I was issued one? Well, the new phones that we engage at ADMS have certain encryption features that the older models and your cell phones may not have. And in some of these personal phones, the encryption system is not automatically turned on by the person because they're unaware that that feature even exists. Other common feedback is, if I need to text my doctor information about a patient, that's no different than calling my doctor? And the response is, when you text or when you call someone on the phone, those are two different means of communication that have different levels of risk. Again, folks, I'm going to ask you to mute your phone if you're listening. We're hearing background noise and background conversations. When you text anything from a mobile device that doesn't have the appropriate security, that information is stored electronically on your phone's cloud storage and can be accessed or hacked. We've heard something from charge nurses that says, I'm under a lot of pressure to treat our patients quickly. It's just easy to text the other doctors and nurses when I need to tell them something. Maybe the dialysis facility should look into purchasing us better technology. And our response is, while convenience may be tempting, the fines for HIPAA security violations have jumped from $50,000 per episode to almost $1.5 million in the last year. And actually, there was a recent memorandum that came out by the Office of Civil Rights in the last 5 days, which increased the fines even further. Most of the fines given by the Office of Civil Rights involve security rule violations, and that PHI was discovered on the internet unsecured. Other common feedback is, I told our IT department I was using my mobile phone to text, and they said they wanted to give them rights to the device so they can wipe it if it gets lost or stolen. I don't want to give our IT department the rights so they can wipe my phone. Our response is, it could be your phone or your iPad, but if you're texting protected health information on your corporate phone, it's the organization's patient information that's owned. So you're putting the organization at risk if your device is lost or stolen and you fail to report it. So in order to use your device, there are some certain trade-offs on information that can be safeguarded. You need to speak to the organization's IT director. So let's understand what you can put a patient information at risk for. And there are many risks and that most people don't think about when they think about. So your device is lost, right? Is the employee reporting the loss to their employer even if the phone belongs to the employee? So if you're using your personal mobile phone for business-related transactions and information to your doctors, to your physician extenders, to your medical director, to your nurses saying that this is going on with the patient. If you're doing that, and that information gets lost, there could be a risk. If your device is stolen, if you leave it in your car overnight, and we've heard that story in annual compliance training where individuals will leave their laptop, their phone, and the car gets broken into, and that information is stolen. Our IT department can actually enforce wiping capabilities where if notified timely and password protected, the ADMS IT department can wipe clean that mobile phone or that iPad, so the next time someone attempts to log on, all that information that was recorded on that phone and its cache or in its download is wiped clean. Other information or other questions that come into play or risk is the employee's phone password protected? You'd be surprised to know how many people don't have passwords on their phone, whether it's a fingerprint password or a number code password. Also, depending on the type of a device, malware and viruses are a potential threat that can be introduced into the workplace. And by malware or viruses, keystroke loggers, that has a way to access your patient records and other documents that you may be storing on a personal mobile device, on your laptop, or even on your desktop. Please remember, and I'll raise this here, though it's unrelated to BYOD, please remember that when you're saving a file or saving a record, do not save it to your computer desktop. Save it to your shared drive under the S folder. In case of viruses, in case of malware, in case your computer system breaks down, if it's saved to your desktop, chances are those documents you've been working on for months and years will never be able to be reaccessed. Save it to the shared drive. If you have a question, talk to your designated IT manager or employee assigned to your facility. Other items that come into play is free Wi-Fi service. If you're using a free Wi-Fi, that information has the opportunity to be hacked or exposed and may expose any PHI to the device, which may result in a theft or a loss of information. So please be careful when you're using your mobile phones in a free Wi-Fi area such as Starbucks, Dunkin' Donuts, Burger King, McDonald's, Panera, and you happen to be either texting PHI-related information or downloading or saving a file so you can review data. So some simple steps we want to talk about for each employee to help your organization stay in compliance. So number one, make sure you use a password. whether it be a fingerprint password or a number password or a word password. That's important. So use a password or some other type of user authentication method. That's the best process of verifying your identity on your phone. And your devices can be configured so you can either have a PIN number, a password, or a passcode. Second item is make sure you've got encryption. Speak to the ADMS department about encryption if you're using your own personal devices for PHI. And again, this is applied not only to employees, but your doctors, your privileged physicians, those staff members who may be communicating with you through their personal phones. Please make sure that they have the appropriate encryption. There is no harm in saying, doctor, is your phone protected? Encryption protects health information stored and sent by mobile devices, and most devices often have a built-in encryption system that can be activated. And if it doesn't, we can purchase that encryption for the device. Also, find out what's going on in your dialysis center. Speak to your assigned ADMS IT manager or IT appointed person. Find out what the encryption capability are and what they can do to get that encryption for your personal device. Of course, ensure that your direct line manager, or if you're in the dialysis facilities, that your nurse administrator is aware of what the conversation is. Don't usurp the hierarchy of authorization. Please make sure that you install and activate any remote wiping or remote disabling, and make sure the ADMS IT department, i.e. Victor Paris, Richard Espinal, are aware if you're using your personal device for information and you lose it, you misplace it. Remote wiping enables you to erase data on the mobile device completely. This can permanently delete data stored on a lost or stolen mobile phone, and the remote disabling enables you to lock your device until it's recovered. Most recently, I had an item with my own personal phone, or I'm sorry, my own ADMS phone. The phone was on, but the screen could not be seen. I guess the screen had just, it moved on in live. And I called the ADMS IT department and I said, you know what, I'd like a new phone, but until that time, do me a favor, guys, please just wipe this phone clean, because I'm afraid if I leave it somewhere, I'm going to forget it, and then whatever information in here could be accessed. And they remotely wiped it clean in a matter of seconds. But again, that is only good if you make sure whatever records are on there are stored securely within the ADMS shared S drive. If you're using any file sharing applications, make sure they're disabled. Make sure you don't install them if you want to, and don't use any file sharing applications. File sharing is a software or system that allows internet users to connect to other to connect to each other and maybe trade computer files, music swapping, things along those lines. But also, file sharing may authorize or enable unauthorized users to access your laptop, your handheld device, or your iPhone without your knowledge. So by either disabling them or not using them, you can reduce the known risk to data on your mobile device. Make sure you install and enable a firewall. The ADMS IT department has a very strong firewall on its system called Spam Titan, but make sure you have a firewall on your mobile device. And these firewalls can protect against unauthorized connections, can also intercept incoming and outgoing connection attempts, and it can also block any attempts to get into your system based on a certain set of rules that you set. Again, speak to the ADMS IT department on any of these items. Make sure you've got security software. Make sure you have a McAfee. Make sure you have whatever system it is. And that software can be installed to protect any type of applications, any malicious viruses, spyware, or any type of malware. Step 7, keep your security software up to date. Once you have security software, keep it up to date. When you get an error message that says this is going to expire, don't wait until 2 weeks or 10 days after the fact of expiration and then say, oh, I should email I should use a Zendesk request and get my security software update. Keep it updated regularly. We have the latest tools to prevent unauthorized access to health information. We can work with you on your devices. Communicate with the ADMS IT department. And if you have any serious concerns, you can call the ADMS Compliance Office, either directly through its staff members or the ADMS Compliance Hotline at 718-483-7403. Make sure you research mobile applications and those apps before downloading. All those free apps, all those 99-cent apps that are all over your personal phones. Those of you using ADMS mobile phones, I know we've got people who have other applications unrelated to any type of business activity going on. An application is a software program that performs one or more specific functions. But before you download and install an app on either your mobile device or your ADMS mobile device, make sure that the app is going to perform only those functions you want. All right? If it's not, then ask yourself, do I really need this app? Especially on your mobile phone, your corporate issue mobile phone. If you have questions, once again, talk to your ID department. And if you're downloading apps, only get them from known websites or other trusted sources. Don't try to avoid certain entities or organizations or websites that you just don't know. Again, all questions should be best directed to the IT department. Make sure you have physical control of your computers, your PDAs, your iPhones. All right, the best benefits of mobile devices are that portable, their small size, and their convenience. But those of you know, it's also very easy to misplace and lose. And those are some of the challenges about both protecting and securing that health information. Mobile devices, as you know, are easily lost or stolen. How many times have you put your phone or your PDA or your iPad down somewhere and it takes a while for you to remember what you did with it? Okay? There's also a risk of unauthorized use and disclosure of patient health information. All right? So by limiting the authorization users' access, tampering or theft of your mobile device when you physically secure the device, make sure you put a certain level of physical control in play. Step 10, as we come close to the end, is make sure you use adequate security. Again, as we talked about public Wi-Fi. Public Wi-Fi networks are very tempting to use. Why? Because they're free. But it's also an easy way for individuals, unauthorized people, to get information off your phone, whether in transmission or on that while you're sitting in this center. And you can protect and secure your health information by not sending it or receiving it when connected to a public Wi-Fi network, when you can use a secure encrypted connection. Those of you within ADMS affiliate facilities, we do have a wireless connection system. Generally, it's ADMS, and then whatever the facility name is, there is a secure password. Again, that information is best directed from the IT manager, your IT director, or from speaking to the ADMS IT staff member assigned to your facility, business office location, or facility practice. Step 11, before you discard a mobile device, before you give your son or daughter your old mobile phone because he or she is getting a little bit older, make sure you delete all that health information. Okay? When you use software tools that thoroughly delete or wipe data stored on a mobile device, you protect and secure that health information from unauthorized access. Again, if you don't know how to do that, speak to the IT department. One of the issues as an organization we speak to is the hard drives in your photocopiers in your dialysis centers. There was a news story, and this is unrelated directly to mobile devices, but you'll understand where I'm coming from. Photocopiers came from a hospital. There was an allegation or a claim that the photo devices, the hard drives, were wiped clean on these printers. These printer copiers were then distributed to CBS broadcasting station, the Channel 2 here in New York. The IT department at CBS, before it implements any of these items, make sure that the hard drives are actually clean before they implement them in service. And what the CBS IT department found out is that the hard drives were not wiped clean. And there contained over 350,000 records of patient health information. So before you give your phone to your child, your spouse, your significant other, your grandmother, please make sure that these items are all wiped clean. Same thing, nurse administrators, charge nurses, and those of you in the ADMS facilities and IT department, please ensure that the hard drives for all copiers, all-in-ones, personal printers are either destroyed, wiped clean with a certification, or retained by ADMS. For more information, to schedule a live presentation at your facility location, or to discuss any part of the ADMS compliance program, call the ADMS compliance office at 718-483-7428. Once again, 718-483-7428. If you wish to file an anonymous call to the ADMS compliance office, that hotline number is 7403. Our next Webinar Wednesday compliance training will occur on August 31st at 11 a.m. We're going to talk about STARK law, S-T-A-R-K law, and our subject is information, regulations, and solutions. With that being said, we're going to open it up right now for questions. I would ask anyone who has any questions if they would go into the right-hand section where it says chat, and please type in a question you have at that time. Okay, I see no questions at this time. I'd like to thank everyone for joining. We appreciate it, and we look forward to seeing everyone on next month's Webinar Wednesday. And I thank you very, very much. Have a wonderful day. Bye-bye.